It's time now for FAQs, frequently asked questions, in which we take a deep dive into a specific topic. Tonight, baldness. I occasionally get called Captain Comb-Over. But will there ever be a cure? Does it matter? Should blokes suffering so-called male pattern baldness just accept reality and shave it off, Bruce Willis style? What about the many thousands of women who suffer from hair loss too? Is there any hope? If so, what is the answer? Medication or the surgeon's knife? To discuss this, I'm delighted to welcome Michael May, FRCS, the principal of the Wimpole Clinic, which is dedicated to the science and practice of hair transplant and replacement. Mr. May is a fellow of the Royal College of Surgeons and has been helping patients for over 30 years. Michael was instrumental in developing the revolutionary technique of follicular unit transplant in the UK, which is now the mainstay of hair restoration surgery worldwide. And I'm delighted to say he joins me now. Hello, Michael.
Hello, hello.
Why is...
Can you hear?
Hair, yes, I can hear you loud and clear. Why is baldness such a problem? Why can't blokes just accept it when it's gone?
I think that's a difficult question. Most men do accept it, but a very small proportion, a relatively small proportion, find it very, very difficult and really want to do something about it. And I think recently, perhaps the number has increased. There are certainly now more men looking for treatments, looking for cures, and indeed coming to the surgery which we provide at the clinic.
And you've been at this for 30 years now. How much better are the technologies and the techniques now compared to when you started?
Well, that is the leading question. I started in the mid-late 80s, and hair transplanting, although surprisingly popular, I sometimes use the word bizarre. Sometimes the results were very, very strange. The doll's head look, round 4mm plugs which were taken from the back and transplanted. And unfortunately, we very, very rarely see that now. But I thought at the end of the 80s, going into the early 90s, that hair transplants would die out. I thought that a cure would come in. Minoxidil became available. Minoxidil still is a treatment, but hasn't by any means cured hair loss. But at that time, transplants did start to improve, and I think have taken us to the position we are now, where not a miracle, but the transplant can provide very good results, natural results. Men are more prepared to discuss it, tell their friends, and I think the public perception has grasped that. A man can have a transplant now and not keep it to himself, feel rather embarrassed about it. It is far more open to discussion.
So if you have severe baldness, you need surgery rather than medication, is that right?
I think so, yes. I mean, medication, there is a medication, a tablet called finasteride, which certainly does delay hair loss. It is well worthwhile, a younger man using finasteride to delay hair loss.
And that's preventative, is it? Is that preventative?
A preventative, yes. I think it would be looked upon as a preventative. There may be a little bit of regrowth, but it's very much used to delay, to prevent further loss. And this can be combined with a transplant to give perhaps the best possible result. Because there is one problem which remains with the hair transplant, and that is that we are not making new hair. We are taking hair from the back of the head where the permanent hair, the donor hair is, and relocating. And I say to every patient that I consult that the clue lies in the word relocating. We're taking some hair and putting it basically on top. So it is a finite resource. And the man who has extensive loss, or indeed is going on to extensive loss, is eventually going to run out of hair which can be transplanted. So there is a limitation.
So you take hair roots from the side and the back, and you put
mainly
them
from the back.
Mainly from the back.
That's right. Mainly from the back.
Once they've been relocated, will they produce hair in principle for the rest of your life? Because very bald people still produce hair at the back of their head, don't they? So does that continue at the top?
Yes, you'll have seen for yourself that a bald man retains a band of hair around the back and sides. And it was first remarked upon, a paper was written in the mid-50s, that hair taken from the back and placed on top, as long as those little roots were not damaged, would grow, and then grow for the rest of that man's life. The theory of donor dominance, the hair roots taken from the back continue to behave as if still at the back. They do not respond to the male hormone, to testosterone. They do not have receptors for testosterone, and therefore do not thin, miniaturize, and eventually disappear.
I see. So we become bald because of hormonal changes, but the hair roots on the side and at the back are not impacted by hormonal changes.
No, they don't. They're not. And hair loss is decided, but genetically, it's inherited from mother and father, comes down. I, for instance, still have a head of hair purely inherited from my family, whereas some men at quite an early age can lose hair on top. And it's probably these younger men who it can become quite difficult to cope with.
Listen, Doc, I'm 47 years of age. I've been nicknamed Captain Comb-Over or Curly Comb-Over by one or two viewers. How am I getting on at the age of 47? Do I need an appointment?
No. No, you don't.
Sure?
You've got a little bit of loss at the front. You've got the top. You've got a little bit of recession at the front, haven't you? You've gone back a little bit. Yeah, you've got a bit of typical male recession. And if you wanted, you could have a younger, not the hairline of an 18-year-old, but you could have a younger hairline transplanted. And that is what men are doing. Men, celebrities, minor celebrities, all types of men are coming in to have hairlines transplanted. And that is what we can do so much better now. It can be done in a very natural way.
So what about the procedure that you do? Is it day case? Can it be done in a day? How long would it take for somebody that was quite severely bald? Is it several procedures?
Yeah. No, I mean, we're doing, it is a day case. It's done in our operating room. It's done under local anaesthesia. Some doctors use minor sedation, but certainly nothing like a general anaesthetic. And a procedure, a good-sized procedure, takes probably about 6 hours. So it's not it's not a 10-minute job, but it's done in the morning into the early afternoon.
And obviously, it's a bit of cash, I would have thought, but, you know, you're clearly very, very good at what you do. A few £1,000s. But if it goes right, it could be with you for life.
It is with you for life. And I think it's, for a lot of men, I mean, as you say, it does cost something, but many men consider it money well spent. They have hair, let's say, at the front, the frontal hairline, and they're absolutely delighted.
I'll give your details at the end. I believe Daniel and my team have fired up a few celebrity photographs for your appraisal. Now, we don't know whether all of these celebrities have had work done, so it's more just a case of your judgment of their hairdo. Let's start with Wayne Rooney, who I think has been open about the fact that he's had surgery. Now, I believe that was before. I don't know if we've got an after. I think we've got an after there. Well done, team. So that you saw the before and the after. What's your appraisal of Wayne's hair procedure?
I think it's good. I mean, Wayne really had it done when he was still quite a young man. He was certainly losing hair at the front. It obviously upset him. He had a transplant. I think it went very, very well. And indeed, for doctors doing transplants, it was extremely beneficial. Many men came in to have transplants, spurred on by Wayne Rooney.
The clock's against us. Can women have this procedure as well? Because female hair loss is a problem, and it's a very underreported problem. It's
true. Women can, but that really is a much more difficult subject. If a man comes to see me, I can be with a fair degree of certainty say this is male pattern hair loss, and he has to decide whether he wants to do nothing, treatment, a transplant. A lady comes in with thinning, it is a medical problem. It has to be investigated, tests carried out, a diagnosis arrived at, and some ladies are then appropriate and can be helped by a transplant. But it is a far more complicated subject.
Michael, I've only got a couple of seconds. Let's have a quick look at the comedian Rob Brydon before and then after. Now, we don't know whether Rob's had work done, but does that look to be a good job to you?
I think that looks very, very nice. It's got a nice hairline, an appropriate hairline. They haven't tried to make him look 18. It looks natural. I would say that's a good hair transplant.
OK, and last but not least, again, we cannot prove that, Lewis Hamilton has had work done, but this is Lewis Hamilton before and then after alleged work. Do you see a difference, and is it good?
That's a difficult one, isn't it? I wouldn't be quite as didactic over this one. It's a different hairstyle, isn't it? The shape of the hairline looks pretty similar. So if he has had a hair transplant, I think he's had a very good one. He's had a nice, a natural result. I wouldn't be as certain over Lewis Hamilton, and I haven't heard anything through the grapevine.
Well, there you go. Well, in that case, perhaps it's all natural. Michael, it's been a privilege to have you on the show. I can direct my viewers to the Wimpole Clinic for more information about what you do. You are Michael May, FRCS, the principal of the Wimpole Clinic, who are dedicated to the science and practice of hair transplant and replacement. Lovely to have you on the show. And thanks for confirming that I'm only in recession and not much more, a bit like the British economy.